Good morning and welcome everyone. I thank all the participants of this 11th webinar organized by Movendo Technology in collaboration with the Synaptic Spinal Cord Injury and Neuro Rehabilitation Center from Calgary in Canada. Before starting, I would like to thank Nguyen, the co-founder and executive director at Synaptic, who will talk today about a clinician perspective on the integration of Hunova. At the end of the presentation, we will open a question session and you can speak directly with our clinical expert by clicking the red arrow at the top to open the control panel. And below you will find a series of functions, including the hand symbol. So you have to click it to ask to speak. Or you can write your questions in the question section in the control panel, and I will read the questions for you. I now pass the speech to Nguyen. Thank you.
Good morning, everyone. Thank you for joining us today, and I would like to thank Movendo for having me here and giving me the opportunity to speak about what it has been like for us as a clinic here in Calgary to integrate the hunova technology. So I'm going to start my slide and presentation here. So as Cynthia has mentioned, that we are from Calgary here, Alberta, Canada, and we operate as a registered charity. And I would just like to be able to share with you some of the thought processes on why we chose hunova and what it's meant for us as a clinic to bring it into integration, and what we've been able to deliver with this technology since we've had it now for about 1.5 years in our clinic. So as I mentioned, Synaptic is a registered charity here in the province. And what we do is we're outpatient care, and we provide a ongoing rehabilitation for people with neurological conditions. We see a vast variety of people with a vast variety of conditions, and our hope is to be able to really focus on functional movement and functional activity. At the clinic, we see a very, very wide variety of conditions, and you can see on the screen here all the things, and I'm just touching on the more common conditions, from cancer to spinal cord injuries to concussions and TBIs, all the way to musculoskeletal injuries. And I think for us as a clinic, when we made the decision to bring hunova in, we wanted to make sure that it would be able to address many of the needs that our patients would need, as well as be able to really address the spectrum of people. So at our clinic, we have many acute cases, people who are just out of hospital or newly diagnosed. And we also have very chronic kind of long-term cases where the injury has been 5 years or the diagnosis has been 40 years. And so when we look at the implementation of technology, we're very cognizant and very deliberate in our decision to make sure that the technology will be able to address most things for most people. And I mean, certainly there is no piece of equipment or technology that's going to address your entire caseload. But I think it is important that when we look at the adoption and the adaptation and integration of technology, that it can be used across the board for as many patients and clients as possible. And from the list that you see here, you can recognize that most of our people have decreased gait or gait deficits. They have decreased balance, decreased coordination, and really overall decreased body awareness. And so this was a really big tying and unifying thread that made us explore and look into hunova to see it as a tool for our very diverse caseload with their diverse needs and individual deficits as well. When we looked at hunova and we looked at technology, the other consideration that came to us, for me, especially as a director and making the decision to bring something like this in, was really the assessment and the evaluation of our team, who is here and who could use it. And our team here at Synaptic is multidisciplinary, as you can see by our list of practitioners here, we have a full menu of rehabilitative practitioners here. And I think something that really stood out for us when we first brought Hunova in was that it was being used by multiple practitioners in completely different areas. So it mostly sits with our physios, our OT, our functional neurology chiropractor has been using it also in the assessment of concussions and the design of treatment and protocols as well. So again, when you're making a clinical decision to bring something into the clinic, I think it is important that you look at the offering in terms of practitioners and whether or not they can use it. With Hunova, there has been no extra credentials that has been needed. Like it didn't have to be performed by a physical therapist, for instance, and it could be performed by a kinesiologist, which then you can change and really benefit kind of the flow of treatment and how things are being delivered within clinic. And something that when we were looking at Hunova and being early adopters, so Synaptic here in Canada has been the first clinic to bring it into the country. We do have a full body of other neurotechnology, so this is not the only tool that we have, and we really don't make these decisions lightly because again, we're looking at integration. So I just wanted to, let you all know that we do have other pieces here as well. And so it was making the decision on how Hunova was going to fit into everything that we have. And would it be a standalone or could we integrate it into a full and robust assessment with treatment and evaluation as well? So we have Excite and TheraStride, and also FES and PONS. For those of you who aren't familiar with what PONS may be, it is a neurotechnology that looks at stimulation through the tongue, straight through the brainstem. What it's been indicated for in Canada is MS and concussions. It is a really intensive program. It's 14 weeks long and it's also very costly. It's $15,000 for the 14 weeks. And so when we combine PONS with the ability to objectively assess and reevaluate and report at the end, it's been a very powerful tool for us to show and to provide the objective evidence at the end and how effective this technology has been. So PONS and Hunova have sat together and have worked together for us in the clinic for about 1.5 years, beautifully actually. It's really been able to elevate what we've been able to deliver to our PONS clients. And I think it's been very critical for us as a clinic to have this type of technology. And so I do want to take a little bit of time and talk to you about Hunova. And I know Movendo does a great job in their website and creating the visuals on how it's used and what it really can do. But this is definitely from a personal clinical perspective on what it has done for us in the clinic. And as you can see, even within the first slide, the variation of sitting position, standing position, and all the things that it can do in the clinic and how important it has been for us. I think for me, one of the things I look at the most when I look at technology is how easy is it to use and how easy is it to implement into what's happening. And I will say to the entire team at Movendo, you've done a great job in making this so very user-friendly. The technology is quite intuitive and it's easy to use. Even though I just spent like 5 minutes explaining all the neurotech in our clinic, I'm not a tech-driven person and I'm not a really good tech user. So I'm the test. If I can use it, that means anyone can use it. But our team has thoroughly enjoyed using it, and the onboarding and the adoption has been very, very easy. And I really do appreciate that because then it allows us to focus on the client and the treatment and not just be fiddling with technology. It has a really small footprint. And for us right now in the clinic, that does matter. Even though we have an extended ramp because we have many wheelchair users, it sits nicely, it's not obtrusive, and it just stays nicely in the clinic. What we've found, not that we were looking to find this, but through a pandemic year, it's actually been very beneficial in compliance with COVID limitations. So it minimizes all the touch surfaces because the patient is contained on the hunova. This is a pre-COVID picture, so neither are masked, but Jill is there spotting, but she doesn't need to be touching the whole time. Clients do have safeties and everything around it, so it gives us a little bit of distance and space. So in doing that, it has been really nice during the implementation throughout this last year for us as a clinic. So truly easy to use and truly easy to implement. And I would also say, I mean, for most of us as clinicians or clinic owners, if you're looking to purchase technology and one that is a commitment, such as hunova, for me personally, it's very important to understand the company that I'm working with, especially we're in Canada, Movendo's in Italy, and so it is important that you know the company and the developers behind the tech will support you however you need to be supported. And I will say that Movendo has been amazing in their support for us in getting the technology here, onboarding with us, and troubleshooting with us, because there always will be some issues, but extremely responsive. And I do thank Movendo for that, because that's made it much, much easier for us. And not all tech companies are like that. Once the sale is made, they will walk away. So it's been really nice and assuring to know that Movendo has been behind us and really wanting us to succeed with this technology. So it's been great. The true power of, the true power of hunova and the driving reason for us bringing it into clinic was its ability to collect objective data. And if you've seen some of the videos and things on what it's able to do, it is quite amazing to know that this is a tool that puts some numbers and some objective data to what we see clinically. So right from assessment through reassessment and reevaluation through to the reporting side. And yes, as clinicians and as therapists, we do have outcome measures that do look at the gait deficits, the balance, and the coordination, absolutely. So this becomes another tool that takes away kind of that tester subjectivity in it, even though we're supposed to be objective, but it takes that away and it gives us concrete numbers. And what we are finding that with hunova and with the assessment and the evaluation, it actually helps us guide treatment plans. And as a clinician, that's really important to me, because sometimes we gather data and that's great. There's no true analysis on the other side, or it doesn't actually add to what we're doing or direct what we're doing. So with hunova's ability to really pick out deficits and be finite, and is it left, is it right, is it rotation, what is it? It then allows us to focus. And I think in that, it's allowed our team to create and design much better and more individualized treatment plans. So the objectivity of this has been amazing. In that data capture, what we have found is that it enhances our ability to report to third-party payers. So for most of us as practitioners, we're looking for that improvement. We're looking for the justification on why a funder should continue with funding or increase funding, right? And again, this becomes another tool where we have numbers that show progress along the way. And we're not necessarily just saying that hunova has created all the improvements, although it's certainly a component of it for sure. It gives us a tool that in our reports that we say that it's gone from 20 to 25. And most of the time on the insurance side, it's being seen and read by non-medical people who are making these decisions on funding. And all they're capturing is the improvement in data. And the fact that hunova does have the silver index and an athlete library of normative values as well, it does give us some ability to compare it to normative values. And I find that that's been very, very important and powerful for us. So on a reporting side, it's allowed us to approach lawyers, it's allowed us to approach third-party payers and say, we can show you the improvement, we can show you that what we're doing overall in the entire treatment plan has been effective. So again, just another objective analyst and tool. And I think just as importantly as everything else, it tracks it for clients, especially for our population when we're dealing with very complex and neuro conditions. Progress and improvement can be so finite and so tiny, and it can be demoralizing when you're working so hard and you just don't see the gains that you want to see. And when clients see that number move up in, whether it's really, really small increments or significant increments, it's validation and it's, motivation to them to keep going. And I think that has been very, very valuable for our team and for our clients as well, is that it's really, really improved client compliance to what we're doing and how we're positioning treatments. And in terms of client compliance, I just wanted to very quickly talk about one of our clients at the clinic and his experience with hunova. He uses it quite a bit. I don't know if this is going at all to Canada, but for those of us in Canada, Ryan Stretchninsky is a name that we all know very well. And Ryan's story began just a few years ago when he was playing hockey and on a junior hockey team, and his team's bus got into a very horrific accident, and I think 14 people were actually killed in that accident. So Ryan has been kind of the face of that story, and Ryan's been working with us since he was discharged from hospital essentially. And Ryan is paralyzed from T4, so chest down, and has been working very, very hard so that he can be on our Canadian sledge hockey team. And for Ryan, because he is so fit, so young, so active and athletic in all other ways, it has been a challenge for us to continue the progression of challenging him in a seated position. So you can see him on hunova here and how he's sitting and how that actually translates to his sled in hockey. We work a whole lot on that seated balance and having Ryan really understand where he's strong, where he's weak, where the imbalances and the deficits are. The other thing that hunova has been valuable for Ryan in this case in particular is that Ryan has actually also gone to Thailand to do the epidural stim. So he has a device implanted in his back that allows for some voluntary movement. And so it was a very big commitment in both cost and time for Ryan's family. And of course, when you are committing that much and placing a whole lot into a procedure, you want to know if there has been value and you want to know if it has worked. So when Ryan came back from Thailand, we were able to capture where his baseline was, work with him through his epidural stim, and continue working with him through rehab with elements of like the hunova included in this, and then track his progress. So Ryan absolutely sees improvement with everything that he's doing. And again, hunova is just another tool, another piece of technology that we've been able to use to say and to validate that everything that he has done has contributed to his success on the ice. And back to what I was saying, in that it has been so client friendly that it really sells itself, to be honest with you. It really does sell itself. People really enjoy using it. The software, the games, the interaction on there has been something that patients love using. As you've seen from our slides, we do have a very diverse group, and we do see children as well. And for us, we do have a relatively significant PEDS case, and as long as they're heavy enough to register on the machine, they've been able to use it and they love it. They love the video games. So they're playing, but they're really working and they're being challenged in so many ways and they don't even know it. And for people who've been doing therapy for so long and have been at it for decades, it's just a very novel and new way for them to be challenged. And for our group here at Synaptic, we see a lot of wheelchair users that are not able to stand. So the fact that Hunova has the force plate technology through a seat has also been another driving force for us to decide and to settle on this piece of technology in particular. So I can say with confidence in our clinic that there has not been a person who's come through our doors that has been unable to use it. So in terms of our ability to deliver and implement, it's actually been 100%. Basically, if they're able to be in clinic, they're able to be on the Hunova, which is amazing. There's not too many pieces of technology for us that has been at least, applicable to all clients. The last few screens are just actual testimonials and words from clients who have used it and how it's added and benefited them through their own therapy. And people from MS to wheelchair users to children to people with stroke, they've all had such positive things to say about the Hunova. Sometimes it feels like I've purchased a toy more so than a piece of no tech. Don't be offended by that, Movendo. That is a big compliment to say that, our team has loved using it and clients have truly loved using it. And we've had such positive feedback on the Hunova that it's truly validated our decision to bring it in and our decision to have it here at the clinic. So it's just like I said, a really quick sweep on what clients have been reporting back, that it's helped them with core, it's helped them with function, it's just been fun to use. All the things that we like to hear as therapists, most definitely. Yes, that concludes my kind of official presentation. And again, it was really just a high-level overview on why we chose to bring Hunova into our clinic and how we've been able to deliver and what it has done to add to our toolbox and how it's improved and elevated our ability to assess, treat, and report on the clients that we see here at Synaptic. So I will hand this back to Cynthia, and if there are any questions, I'm more than happy to answer.